but it's important that when you are teaching your patient psychotherapy, there are certain things after therapeutic relation, we should follow certain rules so that the chances of harm are less to counteract impulsivity. Just make a rule, give a car keys to someone else, a credit card to someone else for just safekeeping, maybe a wife, maybe a father. There should be certain rules about staying out late or giving out phone, avoid alcohol. Chances of relapse are much less, and even if patient goes into the manic phase, chance of harm is less. If his credit card is not with him, his car keys are not there, it should not crash. And another thing which we have to address is, some patients want to stay manic. They like to stay in the manic phase. They feel they are more creative, they are more productive. Why have to take medicine? Then you have to talk to them, remind them that some of the worst events in their life might have happened during the manic phase. Ultimately, these decisions will lead to more disruption in their lives, but this will help in the long run. And I'm just skipping through. These are some things you should follow, but this is psychotherapy. The goal should be modifying behavioral symptoms, negative imagery, activity schedule. Increasing patients should taught to sit and listen. And we should tell them the advantages and disadvantages of technique. And knowing what activities to avoid, alcohol, other substances, unsupervised spending of large amounts of money, daredevil hobbies bipolar patients often have, exaggerated generosity or friendliness with strangers, activities using a lethal weapon. We should help them to cope with their lives, not just them educate about the drugs. So in summary, the integrated treatment utilizing medications, lifestyle and psychosocial treatment is the best option available. The key role of long-term clinical relationship. Patient should trust the doctor and should have a long-term relationship. It is better to you can identify the manic episodes and the depressive episodes and treat them appropriately. Several months are required to assess the effect of new treatment. Use treatments that have proven long-term efficacy. Choose treatments that promote adherence. Early use of best treatment for optimal outcome. And all modern maintenance studies have used enriched design. Enrichment selects patients with known acute response to or who can tolerate the investigational agent. Evidence-based guidelines are limited by the data that are available. So, to maintain the patient in bipolar depression, other than the drugs, lithium, lamotrigine, valproate, psychotherapy and good rapport with the patient is very important, so that patient comes to you for help, seeks your help before causing great destruction to his life. That's all. Thank you.